tight hip flexors, when you have them lie prone on the table, you might see this flexion of the hip when they're on the table. Okay? So for hip extension, if someone's tight, you may see that they actually can't lay flat on the table when they're prone. Now, so you would go ahead and document their starting position, and they may have a hard time getting to zero, depending on if they're tight or not. Now, for our hip flexors, we have our iliopsoas and we have our rectus femoris that are crossing the hip. One is obviously a one joint muscle and the other is a two joint muscle. Now the iliopsoas could be argued that it crosses part of the lower lumbar spine as well, but we pretend it doesn't for the purposes of the length testing, okay? Now length testing is all passive, okay? So you are moving the patient into that position. Now, I say that with emphasis in all caps in my speaking, and then this one we're going to let gravity do all the work, okay? So what I'm going to have you do, Stephanie, is I'm going to have you sit just on the edge of the table. So we're going to do, yeah, good. Okay, we're doing Thomas test. Yeah. You want the person to be sitting on the edge of the table, and then we're going to have her lie back. Now, I'm going to have you, we're going to measure this leg, so I'm going to have you, as you go down, bring this leg. Okay? Yeah. So we're going to have you go ahead and lie back. You can bend your knee. I'm going to have you bring this knee up to your chest. Now, we're measuring the length of this leg. So I want her to bring this leg up until I feel a change in her pelvis again. Okay? I'm going to have you hold this leg. Now, we can measure the length of both muscles on this leg from this position. So if the iliopsoas is tight and the rectus femoris is tight, we will get that number from measuring hip flexion. Okay, actually, I'm sorry, we're measuring hip extension because we're going to record it in a negative number. Yep. So for measuring tightness of the iliopsoas, we're going to measure at the hip, and we're measuring hip extension. So Stephanie is able to get her leg on the table, and so that would be 0 degrees of extension, and that would be normal. The other way that you can measure this is you can use the tape measure method from the back of the thigh to the table, and that would also be 0, obviously, right? So if she was tight in her iliopsoas, her leg might be like this. Okay? So now she is lacking so many degrees of hip extension. So we would document that as a negative number. We also could document this as a number of centimeters from the table. Now when you have the person sit on the table, they need to be close enough to the edge so that the knee is not encumbered by the table. Okay? Now, if I had Stephanie bring her leg up, that affects the position of this leg, right? And so it's really important that you only bring that knee up to prevent the pelvis from going into an anterior pelvic tilt. Okay? Now, for the rectus femoris, we're going to measure the amount of flexion in the knee. So we're documenting extension of the hip, and then we're documenting flexion of the knee. Now we haven't covered how to measure knee goniometry, but it's not rocket science. So we're going to use the lateral malleolus as the landmark for the moving arm. We're going to use the greater trochanter for the landmark of the stationary arm, and then the medial lateral joint line for the axis. Okay, so she is at 66 degrees. You can go ahead and relax and sit up for me. Now, oh good. To document this one is a little bit goofy. So we're going to be in the objective part of the note. We're going to be under muscle length testing. And we're going to do Thomas test. Then we're going to list the muscle, iliopsoas and rectus femoris. And then remember, for muscle length testing, we're documenting the motion we're measuring. So this is going to be hip extension, and this is going to be knee flexion. And then we've got our left and our right. And so for iliopsoas, we could do 0 degrees, we could do 0 centimeters, right? Or if it was tight, we would do like -7 degrees, or we might do 2.3 centimeters. Honestly, I would prefer that you did the goniometry. It's going to be more accurate. The table measurement is going to depend on where you've positioned the person at the edge of the table. So you're going to be more reliable with the goniometry than you are the tape measure. That said, the tape measure method is done clinically.
I don't use tape measure methods ever on this, so where on the thigh exactly would they measure?
So normally you would measure as far distal as possible. You just go up from the furthest edge of the table up to the thigh. And that's the problem with that approach, is that depending on how you've positioned them on the table, you're going to get a different number. So that's why goni is certainly more accurate. Now for the flexion, normal is 90 degrees. So that leg is just going straight down. Okay? Now when I measured Stephanie, I don't think it was her right. Or maybe it was her right. She was at 67 degrees. Okay? So that means that she's tight. Because we're working towards 90. 90 would be normal. Okay? So the norms are 0 for the iliopsoas and 90 for the rectus femoris.
And you got that 90 number by the left leg being in that flex position.
That is the test position. What I measured was the leg that was down.
That's just an example.
Right, the 90.
Yeah.
So
Right. Okay? Now remember, this is a muscle length test, so we are not measuring ranges. We're just measuring endpoints. Okay? Alright, so that's Thomas' test. I can honestly say that I don't ever do this next test, ever. Do you ever do the cone test for length? I always do Thomas' test. Yeah. This next test is rife with problems. Can you have your leg on your back?
Steal this.
Sorry, your other back, your stomach. Thanks. And then, yeah. Is your neck comfortable like that? Sure. Thank you for saying that. So, no pillows, alright? We're in this position, and we're wanting to measure the length of the hip passively, okay? So for this one, this is the reason why I don't like this, I was forgetting. For the iliopsoas, you're saying to flex the knee to 90, okay? And then you measure the hip motion. Well, what have I just done to the rectus femoris? I've lengthened it. So if she's tight with the rectus, as I do this, her hip is going to come up. Okay, but this is supposed to be the iliopsoas test. So I don't like that part of the test. Okay? So what you want to do is bend the knee as much as you can without the hip coming up. Right? And then you're measuring the amount of passive length at the hip. Now, if when you're in this position and you have done nothing, you would, and just like Stephanie was asking the question earlier, can you have someone who's not at 0? This number would be the number for the prone iliopsoas test. Okay, so can you flex your hip here for me? Well, there you go. So if I was going to measure this, going way off. Okay, so she's being quite the actress for me. So I'm getting 24 degrees, which would be a lot of hip flexion. Okay, I would document that as a negative number because she's lacking hip extension. Okay, it's not a standard way to do this test to have the knee straight, and so you would need to document that the knee was at 0 degrees. Everyone following me?
But you want the knee flexed?
The standard test is with the knee bent.
Okay.
I'm telling you that with the knee bent, you're not getting a valid measurement
So you're
here.
saying we should do it this way?
I think you should do it this way, but then you need to document the angle of the knee,
And how
because
would
it's
you
no
write
longer
that?
standard. So,
Are you saying that document that way if they, when they're lying prone flat, you already see a compensation?
go ahead and lay flat for me. What I've documented there is that she's already up 24 degrees.
Right.
I bring the leg up as close as I can to 90, and in her case, when I get to 37, she starts to flex more,
Right,
right? So I would stop there and then take this measurement.
got it.
Would you ever just keep it straight and just measure there and then just document leg straight?
Sure. Honestly, I wouldn't do this test.
Okay.
The
So
Thomas
on
test
our-
is so much more accurate.
On our exam, would you just say like iliopsoas length, and then we could do the Thomas test?
I would have to 100% check on that, but I hate this test so much that my guess is that's what I've done.
Okay.
But I haven't looked, so that would be my guess, is that I would just say do the length test for iliopsoas versus rectus or something like that.
Is there reasoning or research behind why you do this test instead of the Thomas test? Like a counter argument?
Right, right, yeah, you would like to have a balanced argument instead of just me saying I hate it so much.
Curiosity more than anything.
So it could be that you have this person, prone is not a position people really like generally, so that's another reason against this approach. If there was some reason why you had this person in this position anyway, like if it was someone who was coming in with a lumbar problem and you had the person in this position, you could get those measurements without having to flip the patient over, right?
Well, and like you said, if rectus is already tight and we're trying to push them to 90 degrees, it's not gonna be accurate anyway.
Right. So I'm just not a big fan, clearly.
So the only time you would document or do it with her like flat on the table is if she's already.
Even if she was already flexed, I would want to know if it's her rectus or her iliopsoas. And the way I would know that is if I'm able to flex her knee and it doesn't get worse, then I know that that's iliopsoas and not rectus. Okay, so this part allows me to do that differential.
Okay.
So that's the better answer to Tessa's question before. So with just her being in this position, I can't tell you which muscle it is. But if I'm able to flex this a little bit, then I know it's iliopsoas versus rectus. And the stretching will be a little bit different. Stretching in one joint versus a two joint muscle is going to be a little bit different. Okay? Alright, what's next? Alright. So here you are doing basically what I said you would do for the other one. So for both tests, you're measuring iliopsoas length at the hip and you're measuring rectus length at the knee. Okay, whether you're doing Thomas test or the prone test. So Mark just came into my field of view. If any of you ATs have a reason why you would do this in prone versus Thomas test,
I didn't even learn this.
you didn't even learn this one. Okay.
I would guess that if you had like a low back pain, like grabbing your leg and falling back on the table might not be ideal.
Right.
So if they have like a lot of pain or they're older or something, then laying on the table might just be more passive.
I think that's a great counter argument.
That's a mark.
Good job, Mark.
Yeah, Mark.
I still wouldn't do it, but
I've never seen it either,
I
but
just-
that's what I was thinking,
yeah.
is that sometimes people don't like to fall back on the table.
Right. No, and you're absolutely right. If someone is a little bit more frail, or, I mean, for a lot of reasons, they could have testicular problems, or your example is a great one of someone who has a disc protrusion, that is putting a lot of stress on those discs. Okay, so this next test, what you're going to do is you're going to take the person through the knee flexion, monitoring the hip to see when the hip starts to flex, and you're going to measure the amount of knee flexion you can get. Okay, before that hip starts to come up. So you're measuring knee flexion. So you're always measuring hip extension, and here you're always measuring knee flexion. Okay? Okay, so I'm gonna have you lie on your
Quick question,
side.
is there a norm for that, like a 90 or something? Or?
Right, so those are gonna be the same as before, so 0 and 90
Oh,
you're
I
gonna
see.
hold, yeah.
Okay.
Yeah, good question. So I'm gonna have you lie on your side facing the other way. Okay, and I'm gonna have you scoot back towards me a little bit, and I'm gonna have you rest your head on the pillow, ooh, the super fluffy pillow. And I'm gonna have you bend your bottom knee, so you're kind of, that's bad. Okay, so for the over and the modified over, we're measuring the length essentially of the iliotibial band and or the tensor fasciae lata, okay? The iliotibial band is actually lengthened when the knee is straight and shortened when the knee is bent. No, the other way around. It's lengthened when it's bent and it's shortened when it's straight, okay? Based on the axis of the knee. So for the over test, we're actually gonna bend the knee, relax. Now, I have to bring the leg up above neutral, I have to hold the pelvis, and then we passively let the leg fall down. Now, we don't measure this test, it's positive or negative. Positive is that it's tight, and negative is that it's normal. Okay? Some of you are putting dashes for not tested, so putting a dash like I didn't do the test. You need to get out of that habit because that negative means that it's normal. Okay, so you need to put NT if you didn't do the test instead of a dash. Now, typically when we document positive or negative, we'll put the positive or negative in friends. Okay, in this case it means that the right test was positive, so there was tightness there, and the left test was negative. Now, we also can do a modified over. And it gets graded the same way. And now what we're gonna do is just have the leg stay straight. So I'm gonna relax. Now again, this is a passive test. I'm coming up above 90 degrees, or above the plane of her hip, and now I'm lowering it down. And she just has no problem at all with her ITB. Okay? If her ITB is tight, and I have her up here, it won't drop. Okay, it'll stay up there. And what you'll feel, because I'm putting a fair amount of pressure here, what you'll feel is the pelvis will start to come with you, and that'll be an indication of tightness. Okay? All right, so we did Thomas test, modified. Oh, now we're into manual muscle testing. Okay, so go do those 4 muscles, and then we'll finish up.